Welcome to Sex Care is Self-Care. Today, Dr. Christina Vaccaro, a member of the PBF Medical Advisory Board, is here to discuss abuse. How can we recognize it and the resources available right now? Dr. Vaccaro, if you'd like to start off introducing yourself, letting our audience know who you are and what you do.
Thanks, Patty. My name is Dr. Christine Vaccaro, and I'm fellowship trained and double board certified in female pelvic medicine and reconstructive surgery, as well as obstetrics and gynecology. I'm also the fellowship director for female pelvic medicine and reconstructive surgery and an associate professor of obstetrics and gynecology in Bethesda, Maryland. I will take this time, though, to tell you that I had to get some phoning some friends and colleagues for this. I work in a multidisciplinary team, and that includes a women's health psychologist, Dr. Danielle Worthington, and a close personal friend of mine is a licensed family and marriage therapist. Yes, so she's a licensed family and marriage therapist, Jacqueline Mott in Connecticut. So I did have them review this just to make sure I'm giving really good, accurate information for the listeners and make sure that everyone really has a full breadth of information about this very serious condition.
That's what I love about this panel, our board, is that you don't take any of these subjects lightly, that you make sure that you surround yourself with an amazing team so that the information that we are given is accurate and up to date. So that means a lot. Thank you so much for taking this extra time and going the extra mile to help our audience out there that's listening. So let's start with the very first question. How common is physical and sexual abuse?
Yeah, and sadly, Patty, we're going to hear that it's so common, and that's a really tragic tragedy. But violence against women, particularly intimate partner violence and sexual violence, is a major public health problem and a violation of women's health rights and human rights. You may know that the Women's Health or the World Health Organization indicated that globally 1 out of 3, about 30% of women worldwide, have been subjected to either physical and or sexual intimate partner violence or non-partner sexual violence in their lifetime. In the United States, this is nearly 1 in 4 women over the age of 18 have been the victim of severe physical violence by an intimate partner in their lifetime. And as we learn more about health disparities, we also know that women of color and lower socioeconomic status are at the highest risk. I've seen anywhere upwards of 68% in some communities. So this is a serious health concern. As you know, violence negatively affects a woman's mental and physical well-being, as well as their sexual and reproductive health. And the saddest part is this is completely preventable. The health sector has a very important role to play to provide comprehensive health care to women subjected to violence and as an entry point to referring women to other support services they may need. And although you asked about physical and sexual abuse, I wanted to mention that emotional abuse can be just as damaging to a woman. This is termed interpersonal violence or relational abuse. Which includes intimate partner violence. And emotional abuse can take many forms, but a few examples are verbal put-downs, financial control, harassment, threats, etc. And almost half of women in the United States have experienced some form of psychological aggression by an intimate partner in their lifetime. So very, very staggering statistics.
I'm glad. I'm so happy that you added that to the subject because yes, it happens. So thank you. So many victims came forward during the Me Too movement. How common is it for women to be hurt by someone they know versus a total stranger?
Yeah, and I'm glad you brought this up too, because, I think some women think that sexual violence and physical violence just happens randomly, walking down the street or something, and that is almost never ever how it happens. So the Me Too movement really brought this front and center. It brought sexual violence out of the shadows. And just to define what the Me Too movement is, it's a social movement against sexual abuse and sexual harassment where people publicize allegations of sexual crimes. So again, to answer your question, most of the violence is associated with a sexual partner they know, and this is usually not a random act. More than half or 51% of victims of rape reported being raped by an intimate partner, and 41% reported being raped by an acquaintance. So this demonstrates that more than 90% of the time they know the perpetrator.
Those are crazy statistics, scary. Um, we hear the word rape culture and toxic masculinity. Um, can you help us understand these terms?
Yeah, and I had to again do some education myself, just to make sure I understood the terms because they are relatively new. But rape culture is defined as the systems, beliefs, behaviors rooted in the patriarchy that allows for its prevalence in society. So here, that's a big fancy word just to say this is power and control over women. That's basically what it is. For example, if a woman wears a tight outfit, she's asking for it. If she's drunk, somehow the rape was her fault. Or she's just making it up. She's lying about the fact that it happened. So these are just a couple common examples in our culture that we all know. We've all heard these thrown out, but we can change it by speaking up, by supporting our survivors. And just to go to the toxic masculinity, our culture leads men, who are the usual perpetrators, not always, but usually, to believe that they can get away with it. So by their power, their money, their status, that they can get away with these things, and then that somehow what they're doing is masculine behavior and that it's condoned or okay. And the way that I think about this is like locker room talk. It's common for men in the locker room to talk about their sexual conquests, talking about women as objects, degrading women, et cetera, et cetera. This is the idea of toxic masculinity. And so just a question to ponder, what word correlates with slut for men? And there isn't any. And there's a problem with that because men are praised for how many women they can have sex with, while women are criticized. And it really, if we really are thinking about being true equals, we should be on the same playing field, and we're not. Just to highlight this further, I found a study in college men showing that 32% of college men said that they would have sexual intercourse with a woman against her will, quote unquote, if no one would ever know and there wouldn't be any consequences. So this was staggering to me. And this way of thinking must end. So irrespectful of the gender of the survivor, but again, men are usually responsible for the vast majority of sexual violence in America, with 90% of the perpetrators of sexual violence being, again, that are against women are men, so male perpetrators. So again, it's scary, and our culture needs to change. This idea of rape culture and toxic masculinity must end.
I couldn't agree more with you because we have been hearing. It's not like it's been a conversation that has just been brought up recently. This conversation has been happening heavily in the last 2 years. That brings me to my next question. There are so many cases of women reporting intimate partner violence, and there are other women that are coming forward to support the victims and have similar stories with the same abuser. What do you think? Why do you think it's so hard for some of these women to come forward? I mean, I'm sure there's many incidents where there hasn't been anybody to ever come forward and they've gotten away with it. What takes these people so long?
This is a very complex question, and I'm sure for every woman it's different. But in my mind, and in consulting with my women's health psychologist and licensed family practice therapist, really the victims are taught slash told to believe, number one, it's their fault, so they're to blame, and then number two, that they're fearful, and they're fearful of a lot of things, public shaming, bullying, people not believing them. Maybe they might lose their job or their status if it's a work related type of situation. So again, I think they're ashamed, embarrassed. Somehow, again, they brought it upon themselves, so it's their fault. Somehow they're wrong. But again, I think it's extremely complicated if the woman actually loves her abuser, and sometimes he's caring towards her, and then she looks past the ebbs and flow of violence. So I think there's so many layers of complexity to pace based on the situation. And what if the woman's a high profile person, and this news may threaten to ruin her reputation, become public knowledge, being especially embarrassing. But I think the nice thing about the Me Too movement was several famous people took a stand to normalize and to discuss this, put it out in the open, so that, when one brave woman does take a stand, others will also find the courage to support her and realize that they're worth it too. Because survivors ultimately need closure and healing, which starts with coming forward.
You use two of my favorite words in describing any of this, and that is courage and bravery, because it takes both. And so I hear this a lot, especially working with thousands of women. And this is a great conversation that we're having here today. Survivors of physical and sexual abuse can experience many other physical, mental, and sexual health problems. How does this kind of trauma create a ripple effect of the health consequences?
And again, this is such an important question as well. We know that the survivors of interpersonal violence have poor health outcomes overall due to chronic physical and emotional stress, which can manifest in so many ways, but typically chronic pain, especially pelvic pain, chronic fatigue, irritable bowel syndrome, fibromyalgia, migraine headaches, insomnia, other mental health conditions, specifically depression, anxiety, and post-traumatic stress disorder. I mean, these are just a small list of what I see patients come in with that have had a history of sexual violence or physical violence. And these mental health conditions can precipitate other risky behaviors. So they may not know how to deal with the events, either ongoing or in the past. So they might turn to substance abuse for a little help. They might do other risky things like have unprotected intercourse with other risky substance abusers, etc. Or they may even try suicide attempts. So we know that there's so many things that can happen. And then regarding pregnancy complications, we know that pregnancy is an especially vulnerable time. The sexual partner may or may not want another child, even though, usually he is the one abusing the woman. Thus, this abused woman is more likely to have other bad pregnancy outcomes, in addition to the unintended pregnancy, such as miscarriage, preterm labor, low birth weight infants, and even stillbirth. And then switching gears to GYN health, so gynecologic health maintenance, the survivor may be hesitant about getting pelvic exams. She may avoid these exams because she doesn't want to precipitate prior traumatic events. So just doing a pelvic exam on a female that's been a victim of sexual assault can cause PTSD. So this may be impossible or traumatic for her to even tolerate. And on rare occasions, we do have to sedate women if we really need to get an exam for various different reasons because of their prior history. So again, these consequences can all lead to hospitalization, disability, or death. And one note about just adverse childhood experiences. We know that the more physical, psychological, or sexual abuse a child experiences, the higher the likelihood of other chronic physical conditions such as heart disease and diabetes, in addition to other mental and mental health and chronic pain conditions. So it's not just the scars that you can't see, it actually leads to true um, other physical health conditions.
I'm glad that you explained it to, even when after you've come forward and you have said this is what has happened, all the things afterwards that you will go through of, whether it's, talking to a psychiatrist or uncomfortable examinations or, there's just many things that come afterwards. It's just not being brave to tell the story, having that bravery to tell it, but it's what comes after too. These women go through so much. And again, to have somebody supporting you. But they're amazing. These women are very brave. I also want to take a moment to talk about consent. So, what is the consent culture? What is that?
Yeah, I am so hopeful that this is the answer to intimate partner violence, and I'll tell you why. So, consent culture, this goes beyond sex. This applies to everyday interactions, anything from sharing a photo of someone online to asking before you give a hug, which now in COVID days is like you got to ask about everything. So it's literally just asking permission for everyday interactions, and the more we ask permission in everyday interactions, the more this behavior feeds into the bedroom. So specifically for sexual consent, though, this is an agreement between participants to engage in sexual activity. Preferably it's verbal, but there are nonverbal ways as well. But the communication with the other person, you have to discuss what you want. Also determine, that it's okay if your thoughts are aligned, or if they're not aligned, let's talk about that. So having an open communication, and then you got to get specific. So someone phrased it asking what's on the menu. So are we making out? Are we doing something more? What's on the menu of what we're doing? Because just because you're kissing doesn't mean you want to have sex. So getting specific is important. Knowing that consent expires, so you need to have verbal check-ins. So just because you did it last week doesn't mean that it's okay this week. You have to check in. Asking before a shift. So this is, talking about your boundaries before things heat up, because in another study I found, 50% of men over age 18 agreed that if your partner is willing to kiss you, she must be willing to do other sexual acts. So again, you just have to be clear of what you want. And then consent isn't just about sex. It can be other various intimate events: grabbing, fondling, masturbating in front of your partner, use of toys, video or audio recording, and just being clear what's okay and what's not okay with you. I think we've heard this a lot, that ignorance isn't bliss. Just because you don't say no doesn't mean you've said yes. So again, being clear. And then, couples in long-term relationships are really no different. They should also ask permission, especially when their safe zone is shifting. Like, say, for instance, they want to add in a new sexual partner to the relationship, or they want to try bondage or choking or some other forms of sexual intimacy. They need to check in with their partner and make sure that that is okay or not okay. So to summarize, consent is really central to prevention of intimate partner violence, starting with education about consent of both men and women. I saw this cute video that I'm sure everyone's seen. It went viral. It was about, can I borrow your hat? And if you haven't seen it, it's really cute. It's about consent. And it's a great way to teach young kids about consent as well, without having to say the word sex. But just educating both men and women to know that when consent has been obtained, teaching males it's important to ask and not take, and teaching females that giving consent is expected and required. So I hope that one day this consent culture essentially cancels out rape culture. That's my hope.
Thank you so much. I'm gonna look for that video. I have not got to see that video, so
Okay,
I will.
it's good.
I'm going to watch that. Why is this really important to talk to your doctor if you're going through this? Why is it?
Yeah, so just like you would discuss your risk for cancer or high blood pressure, you need to disclose and discuss this history of abuse because it relates to almost all other areas of your life and can contribute to medical problems. So, and as providers, not only, should the patient tell us, we have to ask. So providers should ask just a few simple questions. Are you in a relationship? If yes, do you feel safe in the relationship? For pregnant women who, again, are at higher risk, they're very vulnerable, obstetricians should ask, or their nurse midwife ask if they've been hit, kicked, punched, or pushed. And it's in this, they made it very specific so that women would have to think about those actions instead of, do you feel safe? Because sometimes if yes, I feel safe, but I was just hit and pushed the other day, but I still feel safe. So they tried to make it very specific to really ensure the safety of the mom and baby in pregnancy. And again, if they answer, yes to some sort of violence, then offering resources is critical. Violence that's perpetrated against women is a common cause of death and incapacity in the reproductive age as deaths related to cancer, which we hear about cancer all the time, and it's fine to talk about cancer, but for some reason it's not okay to talk about this, and it needs more awareness. So to summarize, sexual abuse can have a long-lasting impact on a woman's feelings about sex, including just a general aversion to intercourse that can last many years, even a lifetime. Sexual abuse can result in physical effects, and I see this all the time, manifesting in chronic pelvic pain or vaginismus, and there's various other forms of chronic pain conditions of the pelvis. And usually when I take the history, there has been some sort of sexual violence in the woman's history. So
This is all great information. If you or someone that you love is a victim of physical or sexual abuse, what resources are out there for them right now?
Patty, if you Google this, there's a million resources, but the one that I think is the easiest to remember and was recommended by both of my phone some friends for this topic, the resource is the hotline.org. Pretty easy to remember and has myriad of resources available. Usually each state also has their own resources as well. But I think what's important to share here is that the victims, if they come to you or to us for these events, we need to make sure we're maintaining their autonomy. We don't want to choose for them or tell them what to do. So we need to be respectful of their autonomy and offer help. It could be as easy as saying, could I help you with resources? And then this kind of goes back to the consent culture. You're asking her consent to help her instead of taking over and doing something for her. So offer the resources, support her decision, avoid judgment, and then can't say it enough, reassure them this is not their fault, because oftentimes they're made to believe that it is. And then offer some numbers for them that are in your local area. So emergency numbers, that there's 24/7 chat and phone lines on the hotline.org. There's shelters, there's other resources that can be found on that website, the hotline.org. But the bottom line is offer resources, help them get the resources, then those resources help them create a plan for safety, and those are the essential first steps.
Amazing information. Thank you. Thank you, Dr. Vaccaro, for all this great information that you gave us here today on this very important topic. You can go to the PattyBrisbaneFoundation.org for more information on our foundation and our 6 focus areas. You can also download our hashtag Let's Discuss Patient Pocket Cards to help you start your discussion with your physician. Remember, sex care is self-care and sexual health matters.